Hi, I'm Lisa, a registered nurse here with Precision Advanced Specialty Healthcare. Today I'm going to demonstrate for you how you're going to do your syringe pump infusion at home. When we see you in the hospital before you're discharged, we'll go over all the details of how the infusion is performed. This teaching sheet will give you the supplies you need and detailed steps for the infusion. It will also give you some valuable other information that will help you be successful with your infusion at home. Now let's begin by gathering the supplies that we need for our infusion. We're going to need our medication. Your medication will be delivered in your supplies in a syringe just like this one. They will be on ice, and when you take them home, you're going to put them in the refrigerator. They need to be maintained in the refrigerator, but they need to be at room temperature before they are infused. It takes about an hour for them to come to room temperature, so you can take them out an hour before your infusion is due, or they're safe at room temperature for 24 hours. So you can take them out the night before or the morning of, so that you'll be ready for your infusion time. The amount of fluid in your syringe is going to be dependent on the medication that is prescribed for you. And before you leave the hospital, we'll make sure you know exactly what's going to be specific for your infusion. The top of the syringe is going to have a red cap on it that protects the tip of the syringe so that it is not contaminated. The other supplies that we need are saline syringes. You're going to need one saline for before your infusion, one saline for after your infusion. They have a white cap on them. Then you're going to need a heparinized saline to be the last flush that you do at the very end of the infusion. It's going to have a blue cap on it. The saline syringes do not have to be refrigerated. They can be maintained at room temperature. Each one of these syringes has 10 cc's of fluid in it. We will tell you how much of these syringes that you need to use based on your age or your weight. That is also the same with the heparinized saline. This is a small amount of heparin that is mixed with salt water. This is used as the last thing that you flush through your line at the end of each infusion. The heparin is a blood thinner, but the amount of heparin that is in this syringe is very small, and therefore it does not thin your blood and it does not affect any of your medications. It is only used to be the last thing that is flushed through your line at the end of your infusions to keep it slick so that the line doesn't clog. Now the other things that we need are a couple of alcohol pads. We need the tubing that is going to be attached to our syringe for our infusion. Each tubing will have a specific number indicator on it as to the speed at which that tubing works. This tubing is a F120. We will make sure that you know which tubing you need for your specific infusion. You're also going to need the Freedom 60 pump, and this is our pump here. So we have everything that we need for our infusion. The first thing that we're going to do is get our syringes ready. These syringes open by tearing the perforated edge on the side. Each syringe has a small amount of pressure on it and a little air in the top. So we need to break the seal on the syringe and remove the air before we use the syringe. And that goes for every syringe every time we use one. You're going to unscrew the white cap and lift it off. To break the seal on the syringe, we're going to take our thumb right up underneath the lip right here. If we press our thumb and press upward until we feel a pop, and then pull down until we see the liquid come out the top. As long as a few drops come out, then you know there's no air in the syringe. We do not want to touch the tip of this, but even though we have this one ready, we can set it on our clean, dry surface, and the shape of it will prevent it from touching. We'll do the same thing for our other one. Tear the perforation off, unscrew the top, take our thumb at the bottom and push up until we feel a pop, and then pull down until we see the drops come out the top. Our last syringe is our heparinized saline. The mnemonic that we teach you to know the order in which the dose is given is called SASH. and that stands for saline, antibiotic, or medication, saline, and heparin. So if you remember SASH, that will help you remember the order in which every dose is going to be given. We're going to tear off this perforation on our heparinized saline. Our heparinized saline for our pediatric patients has a blue cap on it. That indicates that it is for a pediatric patient. If you receive a heparinized saline that has a yellow cap, do not use that in a pediatric patient. You always want to make sure it's got a blue cap on it. That cap unscrews the same. Just unscrew it and lift it off. There's half the volume in this syringe, and so the pressure on this is a little stronger, so it may take more power to break the seal when you push up. Then you're going to pull down and make sure a few drips come out the top. So we have all four of our steps. We have our saline, our antibiotic, saline, and our heparin. Now we're going to go through how to perform the actual infusion. Of course, any time that you're going to be getting your supplies together for your infusion or touching your IV line, you want to make sure that your hands are really good and clean with soap and water. Wash them for good 10 to 15 seconds and put your gloves on, which will be in the supplies that we provide you when you get discharged. Now, we have all of our supplies here together. Remember that our infusion is in the order of the mnemonic SASH: saline, antibiotic, saline, and heparin. Now we're going to attach our tubing to our medication syringe. Medication syringe will have a cap on it. Just unscrew that cap. You want to make sure not to touch the end of the syringe. Your tubing has, of course, two ends. The end that attaches to your syringe has a wide disc on it. So we're going to remove the cap on that disc, again making sure we don't touch the end. Attach the disc to our syringe, just turning it to the right. That will lock it into place. The medication in the syringe does need to be primed through this tubing all the way to the end to make sure there's no air. So you're going to remove the cap at the end, making sure not to touch either. We're going to just slowly push on the plunger here on our syringe until we see a drop of fluid come out the bottom. Once we see that drop, we see that right there on the end, then we know that there is no air in our line and it's completely primed. We can put the cap back on and we're ready to attach this to our pump. Our pump has an on-off button, this dark gray button. Right now it's in the off position. It also has a turn dial. This turn dial allows you to move this black piece. This is the piece that will cock our syringe into place. So when you begin with your pump, you want to make sure that the black piece right here is completely cocked all the way back to the back side of the pump. If it is not, you're going to turn your knob until you see that move all the way down to the end. Once it's to the end, we can put our syringe in. The syringe will only go in one way. You want to make sure that your numbers on your syringe are facing upward. We're going to slide the end of the syringe into the pump right here. The dial at the front needs to lock into place. So when you pop that down, you want to make sure that's locked into place. So now the syringe has been inserted into our pump correctly. Now we want to begin our infusion. You're going to take the end of your IV line, remove the old orange swab cap, take an alcohol pad. You want to clean the end of your IV line, these ridges in the top, clean all around the sides and in the center for 10 to 15 seconds, making sure that you scrub so that you feel the squeak. We call this scrubbing the hub. You want to make sure you get that good and clean before you begin the infusion. Now the first part of our infusion mnemonic is saline or S. So we're going to take our saline syringe. It's easiest to attach from the side. Just press into the center of the hub. It's kind of spongy there, and so you will press in and then turn to the right. Just push in and turn to the right. Once the syringe is attached, you're going to flush the lumen of your IV line with the amount of saline that we tell you to use for yourself. So today we're going to flush with 5 cc's. We have 10 cc's in our syringe, so we're just going to very slowly and steadily push our black plunger down until we get to the 5 cc mark, and we have flushed our line with 5 cc's of saline. As long as this is attached to the end, this protects the end of our line, so if we had to set this down, we could and it wouldn't get contaminated. Now we're going to attach our pump. So we will hold onto the hub of our IV, unscrew our syringe. Now we're going to attach the tubing from our pump. Remove the cap on the bottom, making sure again not to touch this. You're going to do the same thing, push in and turn to the right to have that attached to your IV line. Once it's attached, you can set that down. To start our pump, we are going to move our on-off button from off to on. We will see this black piece move itself all the way down until it touches our syringe. Once it touches the syringe, the infusion has begun. You're not hearing any sound coming from the pump, but the size of the tubing and the pressure that's being placed on the syringe makes this infusion begin. We will tell you how long your infusion will be for your particular medication. Once the infusion is complete, you will notice that this syringe is empty. So if we tell you that your infusion takes 30 minutes, at the end of 30 minutes, this black part of our plunger will be all the way down at the end of the line, and it will be time to stop your infusion. So if our medication has completely infused, we're going to turn our dial here to the off position. We're going to take the end of our IV line. Again, we're going to hold the hub of it. A little bit of time has gone by, so you want to make sure that you put your that you wash your hands really good with soap and water again, and put your gloves on. Hold the hub and unscrew the IV line. Once you unscrew that, then you will be able to stop the infusion. Now, the medication that has infused can be sticky. And so before we flush with the last 2 parts of our process, we're going to clean the end of our hub again with alcohol. So we're going to clean all around the sides and in the center again for 10 to 15 seconds. Remember the mnemonic that we're following for our steps. We're saline, antibiotic, now saline again. We're going to take the saline, press in, and turn it to the right, press in and turn it to the right, and then we're going to push our black plunger just slowly and steadily, 5 cc's, so all the way down to the 5, or whatever we have told you for your specific infusion. Once we've flushed with the saline, we'll remove that, attach our blue heparinized saline. It attaches the same way. Push in and turn to the right. In normal circumstances, we will also tell you how many cc's that you need to flush with your heparinized saline. For today, we're going to flush with 2 cc's after each infusion. So we're going to move our black plunger from the 5 milliliter mark down to the 3 milliliter mark. Just slowly push that down to the 3. Once we've flushed it with our heparinized saline, we can remove the syringe. And the last thing we need to do is put a new orange swab cap on. You open the orange swab cap, you'll see the wet alcohol pad inside. You're going to take the end of the IV line, press it into the orange swab cap and turn it to the right. Then you can remove the packaging and the end of that orange swab cap will protect your end of your IV line until your next infusion. We do also have a device that we can use to protect our IV line on yours or your child's arm. This will be in your supplies and will give you plenty of extra in case they get soiled or wet. This will allow you to slide this on the arm and keep the IV line very well protected, and maybe keep them from pulling at it or accidentally pulling it out. Now that is all of the steps for our infusion, for our syringe pump infusion at home. If, of course, you have any questions at any time, you can reach us by calling the numbers that we gave you when we instructed you in the hospital. Thank you.